Welcome back, everybody, to Family First. We love connecting with all of you
Yeah.
who, like us,
Uh,
think that family is like the top priority.
Absolutely.
I'm Lex.
And I'm Vera.
And, we know that so many of you are in that, really exciting part of life.
Yeah.
You know, either dreaming of starting a family
Yeah.
or already kind of planning out the future with your little ones.
Yeah.
But I think we got to be honest, sometimes that dream comes with a little bit of a nagging question.
Mm-hmm.
Like, am I running out of time?
Right.
We hear this all the time, that anxiety around the biological clock ticking.
Absolutely.
So today we're going to take a deep dive into the science and the realities of age and fertility.
Yes.
We want to kind of equip you with the knowledge to make those big decisions about your family planning journey confidently.
For sure.
And we've got some incredible insights to share from the University of Utah Health.
Okay.
Including a podcast with Dr. Kirtly Jones.
Mm-hmm.
She's an OBGYN who really breaks things down.
That's awesome.
And the best part is we're not just dropping facts.
Right.
We're going to translate this knowledge into actionable steps you can take today.
Yeah. That's what we love to do.
Plus, we'll give you some tips on how to track your progress toward those precious family goals.
Yes. Love that.
Oh, and before we get started, don't forget to hit that follow button and share this deep dive with anyone who might be dealing with these same questions.
Absolutely. Spread the knowledge.
Now, one of the things that really stood out to us in Dr. Jones's podcast was this idea of a cutoff age for having a baby.
Okay.
Like, is 40 some kind of magical deadline?
That's a great question, and it's a common misconception, and I totally get why people worry about it.
Yeah.
What's really fascinating here is that female fertility does naturally decline with age.
Okay.
But it's not like a sudden drop-off at a certain age.
Gotcha.
It's a gradual thing.
Okay.
And it starts earlier than most people think, around 28.
Really?
But yeah, but it becomes more noticeable after 35.
Okay. So no hard cutoff,
Right.
but a gradual decline.
Right.
That makes sense.
Yeah.
But then Dr. Jones mentioned something that kind of threw me for a loop. She said most of the eggs in a woman's body after her late 30s are abnormal.
Mm-hmm.
Whoa, that sounds a little alarming.
Yeah.
What did that actually mean for someone who's trying to get pregnant?
Right. Well, that's a great question, and I think it's important to remember that the word abnormal in this context doesn't necessarily mean birth defects.
Okay.
What it often means is that those eggs might have trouble developing into a healthy embryo,
Gotcha.
which can make it harder to conceive in the first place.
Okay.
And unfortunately, it also increases the risk of miscarriage.
Right.
Dr. Jones highlighted that miscarriage rates jump from around 15% in the early 20s to potentially 50% in the 40s.
Wow.
So as you get older, not only does getting pregnant become more challenging, but staying pregnant also becomes more challenging.
So it's not just about getting pregnant, it's about being able to carry to term.
Exactly.
That's a really important distinction.
Yeah.
But what about the fear of complications during pregnancy?
Right.
Is that more common for older mothers?
So while there is a slight increase in the likelihood of things like high blood pressure and diabetes during pregnancy for older moms,
Right.
those conditions are often manageable with good medical care.
Okay.
The bigger hurdle, like we were just talking about, is often conception itself.
Okay.
Yeah.
That's good to know.
Yeah.
So we've talked a lot about female fertility, but what about the guys?
Mm-hmm.
Does age affect male fertility too?
Absolutely. It's definitely a factor for both partners.
Okay.
And while male fertility doesn't decline as drastically until the late 40s or even later, aging sperm can have abnormalities, and older men are more likely to have health conditions that can make it harder to conceive.
So it's definitely a conversation both partners need to have
Yes, definitely.
as they're planning their family.
Absolutely.
Now, we've covered the biological side of things,
Mm-hmm.
but I think there's another piece of the puzzle here.
Okay.
Technology.
Right.
Dr. Jones talked about early screening for genetic abnormalities,
Yeah.
and then assisted reproductive technologies, things like donor sperm and eggs.
Yeah.
How do these advancements kind of fit into the bigger picture?
Well, this is where technology offers so much hope, especially for couples who are facing age-related infertility. These options really empower couples to make informed choices about their pregnancies.
Okay.
And early screening, for example, can detect potential genetic abnormalities really early on in the pregnancy,
Gotcha.
which allows for informed decision-making.
Yep.
It's really amazing how much technology has advanced in this area.
It really is incredible.
That is.
It really is incredible. But alongside these incredible medical advancements, Dr. Jones also emphasized something else that really resonated with me. And that was this idea of pair bonding and how it relates to starting a family.
Mm-hmm. Yeah, it's so important. Sometimes you might be like biologically ready in your early 20s, but not necessarily prepared in terms of like your relationship or your
Right.
life circumstances.
Yeah.
Like finding the right partner, building a stable and supportive relationship, that's huge.
Yeah, it makes sense, right? Like you want to feel secure and ready to kind of take on the challenges and the joys of parenthood together.
Exactly. Dr. Jones really stressed that, having a stable relationship, having the time and resources to provide care, and just being emotionally prepared.
Hmm.
These are all fundamental things for successful parenting, and they often take time.
Yeah, it's about finding that sweet spot, right?
Mm.
Where you feel personally and professionally ready,
Right.
but also being mindful of that biological clock.
Right, it's a juggling act.
It is.
Yeah, there's no one-size-fits-all answer. But I think what really stood out to me from Dr. Jones's message was just the importance of being informed and making choices that align with your own values and priorities.
Yeah.
Like, knowledge really empowers you to make the best decision for your own unique situation.
And speaking of knowledge, I think this brings us to a really important point that Dr. Jones kept coming back to,
Okay.
and that's open communication with your healthcare provider.
Oh, absolutely. Having those open and honest conversations with your doctor about your individual circumstances, your health history, your family goals, can make a world of difference.
Yeah.
It really empowers you to take control of your reproductive health and make choices that feel right for you.
Yeah. And Dr. Jones even mentioned how most people now know that if you have a baby in your 40s, if you get pregnant in your 40s, there are going to be more things to screen for.
Right.
It's a reality that couples delaying pregnancy need to be aware of.
It's true, and those screenings are so important.
Mhm.
They provide valuable information and help couples make those informed decisions about their pregnancy journey.
Yeah.
But it's important to remember that technology isn't a magic solution.
Right.
It's really crucial to go into this with realistic expectations.
You're right. It's not always a guaranteed happy
Yeah,
ending.
yeah,
But even when facing challenges, being informed and having those open conversations with your doctor, I think can really make a world of difference.
for sure.
It can be incredibly empowering.
It can be, and let's not forget about the emotional aspect of all of this.
Yeah.
Like delaying pregnancy, it can be a roller coaster of emotions.
It definitely can.
Yeah.
There's that excitement of planning for a family,
Mm-hmm.
but also those nagging doubts and anxieties.
Mm-hmm.
The pressure to achieve certain milestones by a certain age can be overwhelming.
Absolutely. And then there's the potential emotional toll of infertility. It
Yeah.
can be so incredibly challenging
For sure.
for individuals and for relationships.
Yeah.
So it's so important to acknowledge those feelings and seek support if you need it.
Absolutely.
You don't have to navigate this alone.
That's so important. And sometimes it feels like there's this societal expectation to have everything figured out by a certain age,
Mm-hmm.
to hit all the milestones in a specific order.
Yeah.
But the reality is everyone's path is different,
Yeah,
and there's no right or wrong way to do things.
I completely agree. It's about finding what works for you and your partner and creating a family on your own terms. And I think Dr. Jones's message really embodies that. She
Yeah.
acknowledged that delaying pregnancy for lifestyle reasons, it can be a valid choice,
Right.
but it's crucial to be aware of those potential biological trade-offs.
Right. And I loved how she emphasized that it's all about being informed.
Yes,
Knowledge is power, as they say.
absolutely.
And the more you know about your own body and the realities of fertility, the better equipped you are to make those choices that align with your goals.
Exactly. So to recap, I think the biggest takeaways here are that age does impact both male and female fertility.
Mm-hmm.
And the ability to conceive and have a healthy pregnancy does decline over time.
Yes, and those open and honest conversations with your doctor are vital.
Absolutely.
They can help you understand your individual situation and create the best plan to achieve your family goals.
Exactly. And with that knowledge in hand, you can start taking those actionable steps
Yes.
towards building the family you've always dreamed of.
Yeah, it really is empowering to have all that information. It helps us make more informed decisions about our lives and our futures.
Mm-hmm.
But information is only powerful if we actually put it into action.
Right.
So let's talk about those actionable steps we promised at the beginning.
Okay.
Knowing what we now know about the biological clock,
Yeah.
what can we do today to move closer to our family goals?
Well, that's the million-dollar question, and the answer is going to be different for everyone.
Yeah.
But here are a few key things to consider.
Okay.
First, even if you're not planning to start a family right this second,
Mm-hmm.
if it's somewhere on your horizon, talk to your doctor.
Okay.
Get a baseline understanding of your reproductive health.
Okay.
It's never too early for that conversation.
That's such good advice, just being proactive.
Exactly. Be proactive. And second, be honest with yourself about your priorities. What matters most to you right now?
Yeah.
Are there personal or professional goals you want to achieve before you dive into parenthood?
Right.
It's perfectly okay to have ambitions beyond having kids, but just factor those into your timeline.
It's about finding that balance, right?
Yeah.
And being intentional about how you create your life.
Absolutely. And finally, if you are actively trying to conceive,
Yeah.
be patient.
Mm-hmm.
It's a journey, and it doesn't always happen on our preferred schedule.
Right.
And don't be afraid to seek help if you need it.
Okay.
There are so many incredible resources available, including fertility specialists who can guide you and provide support every step of the way.
Those are all fantastic points. Knowledge is power, but only when we actually use it.
Yeah.
So take what you've learned today.
Mm-hmm.
Have those open and honest conversations with your doctor, with your partner,
Yes.
and start taking steps toward those family dreams.
And remember, you don't have to navigate this journey alone.
Mm-hmm.
There are communities, there are online resources, and professionals that are ready to support you every step of the way.
We'll be sure to include some helpful links and resources in our show notes.
Awesome.
And as always, we love hearing from you, so feel free to share your thoughts and questions in the comments.
Yes, please do.
Thanks for joining us for another deep dive on Family First.
Absolutely.
We'll be back soon with more insightful conversations to help you build the thriving family you've always envisioned. Until then, take care.